Active surveillance is a very reasonable option for appropriate patients to take. It's been increasingly used now. We know some prostate cancers are never going to cause a patient a problem, and those prostate cancers are the ones that should be monitored. The advantages of active surveillance include that the patient maintains their quality of life. They avoid complications of treatment such as surgery and radiotherapy. The disadvantage is that there is a small chance that the disease may progress going outside the confines of the prostate. There is also increased anxiety for patients. Some patients find it's very difficult to watch their cancer. And also the other potential disadvantage is that there can be increased scarring with repeated biopsies, making a subsequent nerve-preserving procedure more difficult. The studies have shown that up to 30 to 40% of patients on active surveillance end up having treatment within 5 years, either because of disease progression, PSA elevation, or anxiety issues. The ideal patient for active surveillance should have a PSA less than 10, a Gleason of 6 or below, less than 3/4 of their prostate biopsy is positive, and no significant PSA velocity. Ideally, older men are very well suited to this option, and perhaps young men who want to maintain their quality of life. It is very important, however, to be continued to be monitored. We monitor patients by doing a PSA every 3 months and a biopsy again at 1 year and perhaps every 1 to 2 years after. There's also an evolving role of the use of MRI in this situation. So active surveillance is an option that I discuss with all my patients, and a large percentage of them do choose active surveillance, and we monitor them very carefully. If the disease progresses, we can always intervene and treat the patient. It's not what is normally known as wait and watch, which is just leaving the cancer alone. It's active surveillance with intervention when required.